My name is Roxanne Sambo. I'm a Gulgada woman from the far west coast of South Australia, so Ceduna is my hometown, and currently I do some project work back home in my community or my region in Ceduna, and I also do some contracted training for Nindi training up in Alice Springs. That's around delivering training to Aboriginal communities, so some very remote communities around Central Australia. So yeah. It feels good, especially to be amongst other Aboriginal health workers and practitioners, and just sharing stories and the great work that the many Aboriginal health workers and practitioners are doing in their communities. Meeting and greeting and sharing those stories and experiences is really important. Oh look, it means a lot to me as a trainer, educator, and more so in the field of Aboriginal primary healthcare training. It really means a lot to me around developing training and giving capacity to mob in community to take control of the health status of our mob. So for myself as a trainer educator, I'm really passionate about building the capacity of Aboriginal health workers and practitioners to be able to, bridge that gap in community around health, disease and burden for our mob. I started as a young Aboriginal health worker back home in my hometown of Ceduna, in the local Aboriginal Health Service, Ceduna Kuniba Aboriginal Health Service. I started under the guidance and supervision of an auntie who I still class as my biggest mentor and teacher back then. Auntie Gwen Miller has always been, from an early age, my mentor. And from her support and guidance, the passion grew for myself in working within my own community and seeing the health disparities and the health, disease and burden in the community with our mob. And I was more working around the health education and promotion team, so I wanted to get out and work in community and raise awareness and develop health education and promotion programs, so informing mob of what is good health. If you have the passion or the fire in your belly to make change in your community, then do it, and with conviction, because for myself, working in the Aboriginal health field for over 30 years plus and still in this space now, that fire in the belly still sits with me because it's so important. And I encourage any aspiring young Aboriginal health worker practitioner, just go out there, do it, get your training, get your qualifications, because it is the most rewarding work that you will ever do in your lifetime. Because if we can change one person's attitude or outlook on health, then that is an achievement in itself, and working towards closing the gap. So I just encourage you to get out there and get your qualifications, work with our mob to help improve the health outcomes. I've worked in the Aboriginal health field for 30 plus years, and I've travelled nationally around Australia, and I've travelled to some remote communities, very remote communities, and I've seen some real health disparities for our mob in, you know, remote and very remote communities, and that's not to take anything away from, you know, urban and metropolitan areas. But you know, one story I will share is when I was up in Tiwi Island, and I was working in a remote community and looking at some of the health disparity and environmental health impact on community foot health. I was at one of the community stores one morning, and one young community member, he was a young man in the community, walking with a huge lump on the side of his leg, and you know, it really hit home for myself, and I actually cried because I thought, you know, to myself, we're living in the 21st century. How can this be happening? Our mob still living in third world health conditions. And I sat with that for a moment to really reflect and think to myself, there is a lot more to be done in improving the health outcomes for our people. So that's why I still have that passion and that fire in my belly. And that particular experience sticks with me each and every day when I'm out there working in remote communities and back home in my community, and it's something that will, yeah, continue to stay with me forever. As Aboriginal health workers and practitioners, we know our mob and we know our communities. So we are best placed to know what is right for our mob when we talk about health, improving health outcomes. So that's the most important message I can say, is that as an Aboriginal health worker and practitioner, we know our mob and we know our community, so we know what's best for our mob. I think for myself as a trainer educator around, you know, Aboriginal primary healthcare, I just recently graduated in a diploma in Aboriginal primary healthcare practice through Bachelor Institute in June. So I've stepped up throughout the years, and I always maintain that mindset that I want to stay connected with community, you know, and work within grassroots level. So for me, continuing the work that I do and giving capacity to Aboriginal community, you know, health workers and practitioners is important. So, you know, continuing the remote Aboriginal health worker practitioner training is something, you know, I see myself in that space for the next 3 to 5 years. And developing my skills and my professional development. So, you know, I'm interested in public health, so it's probably something I might look at next year in studying, and just to continue my own development as an individual, and being able to share and pass that knowledge on is really important. The most important thing is I try and look after myself, number one. So, you know, fitness, good eating, health, diet, nutrition, exercising. And I say that because I want to be in the best of health, so I can pass that knowledge on to my children and my grandchildren, and to share that knowledge and to practice that. So as a health worker practitioner, you know, I need to be able to be role modelling that. So I look after myself, being connected with my family, my children, my grandsons, and going back home on country is really important. Having that connection to country and spiritual connection is really important. And being around good friends keeps me in good health. So that's really important.